I am MGH.
My name is Takara Stanley, and I'm a caregiver, a teacher, and a learner.
I am Jenna Caskey, and I am an advocate, kind, and compassionate.
My name is Robbie Goldstein, and I'm the medical director of the MGH Transgender Health Program, and I am MGH. There's something unique about this place. There's something incredibly special about Mass General. I think a lot of it goes back to the mission of Mass General and where we started in 1811 with the phrase that when in distress, every man becomes our neighbor. Now I like to say that we should maybe change that to when in distress, every person becomes our neighbor so that it's not so gendered. But I do think that that idea, that concept, is at the core of everything we do at this hospital. And we see that from the leadership and how they make sure that we are thinking more broadly about our community. We see that in terms of the patients that we are taking care of, and we see that in the workforce that we're trying to develop here at Mass General. I am a leader, I'm an advocate, I'm a clinician.
I am Arielle Fry-Vogel. I am a physician, educator, and mentor.
My name is Kurt Citrillo. I'm a plastic surgeon, and I help patients complete the surgical chapter of this amazing journey. My evolution towards gender affirmation surgery actually came from a trauma perspective. We were working with developing protocols for genitourinary reconstruction for wounded warriors, as well as cancer patients. This led us to developing the protocol for the first penile transplant in the United States. And as we obtained these surgical skills and outcomes that were very favorable for our patients, we decided to apply this expertise towards the gender affirmation population. I hope our patients feel affirmed, complete, and at peace.
I hope that patients feel welcome, loved, and heard.
My name is Dallas Dukar. I'm a psychiatric mental health nurse practitioner, and I am MGH. The rate of suicidality in the trans population is somewhere up to 60%, which is a huge number. With support, that goes back down to the national average. With appropriate treatment, it goes back down to the national average. There's no other suicide prevention treatment we know of that is that effective. So what am I about? I'm about affirming, I'm about compassionate care. I hope that all of our patients here feel seen, affirmed, and authentic.
Through my work, I hope that our patients feel supported, comfortable, and understood.
My name is Mitch Kellaway. I work for Patient Access Services, and I am MGH. As the training specialist for Patient Access Services, I'm involved in training staff actually across the hospital in registration and admission and some financial service activities within Epic. So when we added the ability to enter sexual orientation, gender identity, sex assigned at birth at the registration level, was previously just at the clinical level within Epic, there was definitely a training need there. So for our department specifically, Patient Access Services, I developed a training on definitions, on the need to gather this kind of information, why we do it, kind of some of the health disparities involved, how to do it in Epic, and then how to talk to patients who may be asking you to enter this identifying information in their registration record. So that was a really exciting change, a big win for the patients to be able to have multiple access points to be able to put that information into their record. I am passionate, informed, evolving.
I hope my patients feel heard, affirmed, and empowered.
I'm Alex Karoglian, pronouns he, him, his, or they, them, theirs. I'm the director of the MGH Psychiatry Gender Identity Program. In the fall of 2018, we were really excited to start an MGH Psychiatry Gender Identity Program to develop tailored mental health services for trans and gender diverse clients and patients at the hospital. We're very excited to be revolutionizing medical education by integrating trans care into the longitudinal curriculum at Harvard Medical School to ensure that all future graduates can provide outstanding gender-affirming care and emerge as leaders in the trans health space, regardless of which specialty they end up pursuing.
I am MGH.